Ourselves more than ever as we work and socialize on video calls.
But Perry, not everyone likes what they see, and that is triggering a so-called Zoom boom of cosmetic work.
Being a pandemic graduate, you just have to take it easy on yourself.
Alexandra Houlihan is on video calls 4 to 5 hours a day.
I was looking at myself on camera constantly, being on Zoom meetings.
And always staring back at her.
I felt like when I turned to the side, I had sort of like a double chin.
But not anymore.
Tiniest little change, and most people wouldn't notice it, but to me, it made a huge difference.
The 29-year-old had a neck liposuction.
I feel like there's now this little shelf almost.
There's definitely a Zoom boom.
Dr. Sean Doherty, a plastic surgeon in Boston, says business is booming during the pandemic because his patients are
working remotely, and the fact that I didn't really have to worry about downtime, and I had, extra sort of savings from being at home and not doing anything.
They see themselves in the mirror and on computer screens so much more than they have before.
What were some of the most popular procedures requested during the pandemic?
So non-surgical would be lip augmentation, Botox, and then overall skin care. Surgical treatments are the chin liposuction and the neck lift, liposuction in the body, and then breast augmentation.
Dr. Shadi Karosh, a dermatologist at Mass General, co-authored a study on this boom, coining Zoom dysmorphia.
We wanted to use a catchy term that would stimulate a discourse for a phenomenon that we were observing.
Researchers surveyed 100 board-certified dermatologists nationwide.
Over 85 that would stimulate a discourse for a phenomenon that we were observing.
Researchers surveyed 100 board-certified dermatologists nationwide.
Over 85% of them reported that their patients were citing video conferencing as one of their reasons for seeking cosmetic consultation.
And they also studied how cameras alter facial proportions depending on focal length, which is the distance between the lens and the subject.
We found that the cameras on our devices, our smartphones, our laptops, actually cause a greater distortion than a regular camera.
She says if you're fixating on a perceived flaw, take a step back literally and turn it off.
Ask lots of questions, ask about risks, ask what bad things can happen, and if bad things happen, how is that doctor going to help you through that?
It was a no-brainer for me.
And a decision that's given her more video confidence.
So cosmetic doctors expect business will stay strong even after the pandemic.